High blood pressure is one of the most common health problems in the world. Millions of people take medicines every day to control it. But most people swallow these pills without really knowing what they do inside the body. One of these medicines is Nebivolol. Doctors often prescribe Nebivolol for people with high blood pressure. Sometimes it is also used for certain heart conditions. At first glance, it may look like a regular blood pressure medicine, but in reality, Nebivolol is quite different from many older heart drugs. What makes this medicine interesting is that it works through two powerful mechanisms at the same time. It slows down the heart, and it also relaxes blood vessels. Because of this unique combination, Nebivolol can influence the cardiovascular system in several important ways. In this video, we will explain 10 powerful effects of Nebivolol on blood pressure and heart health. Understanding these effects can help you better understand how this medicine supports the heart. Effect 1. It slows down the heart rate. The first major effect of Nebivolol happens in the heart. Nebivolol belongs to a group of medicines called beta blockers. These medicines work by blocking certain receptors in the heart known as beta-1 receptors. When these receptors are blocked, the heart begins to beat more slowly. A slower heart rate means the heart does not have to work as hard. Instead of pumping rapidly under pressure, the heart moves into a calmer and more controlled rhythm. This reduction in heart rate is one of the key ways Nebivolol helps protect the heart. Effect 2. It lowers blood pressure. The second major effect is the one most people expect. Nebivolol lowers blood pressure. High blood pressure, also known as hypertension, puts constant stress on the heart and blood vessels. Over time, this pressure can damage arteries and increase the risk of heart attack or stroke. Nebivolol helps reduce this pressure in two ways. First, it slows the heart rate. Second, it relaxes blood vessels. Together, these two actions reduce the force pushing against the walls of the arteries. As a result, blood pressure begins to decrease. Effect 3. It relaxes blood vessels. One of the most unique features of Nebivolol is its effect on blood vessels. Unlike many older beta blockers, Nebivolol increases the release of nitric oxide in the body. Nitric oxide is a natural molecule produced by the lining of blood vessels. Its job is to relax and widen those vessels. When blood vessels widen, blood can move more easily through them. This process is called vasodilation. Because Nebivolol stimulates nitric oxide release, it helps blood vessels stay relaxed and flexible. Effect 4. It reduces the workload on the heart. When the heart beats slower and blood vessels relax, something important happens. The heart no longer needs to pump as hard. Think of the heart like a pump pushing water through pipes. If the pipes are tight and narrow, the pump must work harder. But if the pipes widen, the pump can work more easily. Nebivolol creates that easier environment for the heart. This reduced workload can be very helpful for people who already have heart problems. Effect 5. It improves blood vessel function. Inside every blood vessel there is a very thin inner lining. This lining is called the endothelium. The endothelium plays an important role in controlling blood flow. It releases substances that help vessels expand or contract. When this lining becomes damaged, blood vessels may lose their ability to relax properly. This can contribute to high blood pressure and cardiovascular disease. Nebivolol helps improve the function of this lining by increasing nitric oxide activity. This supports healthier blood vessels over time. Effect 6. It reduces resistance in the circulation. Another important effect of Nebivolol is the reduction of resistance inside small arteries. In many people with hypertension, the small blood vessels remain tight and narrow. This creates resistance to blood flow. The heart then has to push harder to move blood through the body. Nebivolol relaxes these vessels and reduces this resistance. As resistance decreases, blood flows more smoothly through the circulation. This is another reason why blood pressure begins to drop. Effect 7. It can support certain heart failure patients. Some patients suffer from a condition known as heart failure. In heart failure, the heart cannot pump blood as effectively as it should. The heart muscle becomes weaker or less efficient. Certain beta blockers are used to help these patients. Nebivolol is one of the newer options. Studies have shown that nebivolol can help improve heart function in some heart failure patients, especially older adults. By reducing stress on the heart and improving circulation, the medicine may help the heart work more efficiently. Effect 8. It maintains healthy blood flow. Some older beta blockers reduce blood pressure, but also decrease blood flow to certain tissues. Nebivolol is different. Because it improves nitric oxide release and relaxes blood vessels, it can help maintain healthy blood flow throughout the body. This means organs and tissues may still receive adequate oxygen and nutrients while blood pressure is being controlled. Effect 9. It influences the hormone system that controls blood pressure. Blood pressure is not controlled only by the heart and blood vessels. Hormones also play an important role. One of the most important hormone systems involved is the renin-angiotensin system. This system regulates blood pressure and fluid balance. Nebivolol can reduce the release of renin from the kidneys. Renin is an enzyme that starts a chain reaction leading to the production of angiotensin II, a substance that tightens blood vessels. By reducing renin release, nebivolol indirectly helps prevent excessive vessel tightening. Effect 10. It may protect the cardiovascular system over time. All of these effects together create long-term benefits. When blood pressure stays controlled, the heart does not face constant stress. Blood vessels remain healthier. Circulation improves. Over time, this may reduce the risk of serious cardiovascular events such as heart attacks or strokes. This is why controlling blood pressure is one of the most important steps in protecting long-term heart health. Like all medicines, nebivolol can also cause side effects. Some people may experience fatigue. Others may feel dizziness, especially when starting the medicine. Because the drug slows the heart rate, some patients may develop a heart rate that is too slow. Low blood pressure can also occur if the dose is higher than needed. For this reason, nebivolol should always be taken exactly as prescribed by a healthcare professional. Nebivolol is considered a modern third-generation beta blocker. What makes it unique is its dual action. It slows the heart while also relaxing blood vessels through nitric oxide release. Because of these combined effects, nebivolol plays an important role in the treatment of hypertension and certain heart conditions. Understanding how medicines work helps patients make more informed decisions about their health. And when used correctly under medical guidance, medicines like nebivolol can be powerful tools for protecting the heart.